So first of all, I'd just like to ask, I'd like to say how much I really liked your book, and I really liked the way that you started to present it, and the way you talked about how science had started out from a historical perspective, and perhaps you'd just like to talk about the scientific methods and how that sort of came about.
All of my books, all of them, four, all start off historically. So with Fermat's Last Theorem, I go back to the ancient Greeks. With the code book, I look at ancient Greek codes. With this book, I look back at ancient Greek medicine. And I think the reason for that is, one, I like history. I like stories, like people. Some of those stories are wonderful. And secondly, I think if I'm trying to explain ideas, then you start off with the earliest ideas and you take people through those ideas step by step, building things up. So in the case of medicine, the key idea that I'm trying to introduce in chapter 1 was the idea of testing in medicine, the clinical trial. Where did that come from? And that emerged from a Scottish naval surgeon called James Lind, who was trying to find a treatment for scurvy. And instead of just trying things willy-nilly, he did a controlled clinical trial. Took 12 sailors, 6 pairs, each had the same level of scurvy, each had the same diet in the same part of the ship, well controlled, but he gave each pair a different remedy. Seawater, vinegar, sulfuric acid, cider, lemon juice. And those who took lemon juice improved significantly more than any of the others. In fact, none of the others really improved at all. That demonstrated that somehow lemon juice was effective for treating scurvy. Small trial, but a very clear result. And that pivotal idea of being able to test what's good and what's not good, what's dangerous and what's safe, is sort of the starting point for the rest of the book. Edzard, the co-author of the book, I think, it's for someone like him, his entire career has been built on this idea of double-blind, randomized controlled testing and so on. But for the lay reader, it's a completely new idea. So we wanted to start off with that.
I like the way you use that sort of historical device to introduce sometimes difficult scientific fundamentals. And I guess I want to come on to next is who your book is aimed at as well. Because I think it's a really nice sort of approach that both you and Edzard Ernst actually took in writing it. So perhaps you'd like to talk about who your book's aimed at.
I always write books that I think I'd be interested in. So I'm interested in science, I'm curious about the world around me, I'm interested in issues that are concerning society. So hopefully it's of interest to people a bit like me. But it's also aimed at people who might use alternative medicine, who may have a family, who may want to know what alternative therapies are good for their children or for themselves, what works and what doesn't work, what's safe and what's dangerous. So for example, if somebody's spending £100 a year on alternative therapies, then it's worth them buying a book to tell them where they should be focusing their spending. So that was another part of our readership. I don't think the book is aimed at alternative health practitioners. I think if someone has spent 5 years studying reflexology and 10 years as a reflexologist, one of the things we were talking about tonight with the audience here at Skeptics in the Pub was the idea that if your career, your view of yourself is based in the healing you do, it's very hard to then argue with a person using hard evidence.
Sure.
So I don't think it's aimed at alternative therapists, but it's aimed at people who may consider going to alternative therapists, or people who are interested in that boundary between science and pseudoscience.
Yeah, I know.
And I should stress one thing really important. The book is not, it often gets painted as an attack on all alternative medicine.
I don't think it is.
Well, yeah, I'm glad that you pick up on that, because what we do is we look at each alternative therapy one by one, and we try and look at the evidence for each of them one by one, and try and decide whether acupuncture works. If it does work, maybe it works for pain, but not hay fever, and so on. So I hopefully we don't make a blanket judgment. Well, yes. I know we don't, because we spend a lot of time looking at each one.
No, and I think that's a really useful approach, and I really commend you for that. I guess what I want to next ask relates to that. Was there anything that sort of changed your mind about writing the book? Are you more sceptical about certain things, or would you embrace certain complementary medicines after researching this?
I think what surprised me most was the amount of research that has been conducted.
Right.
I think there were some therapies I'd never even heard of before, let alone realise that research had been conducted. So often you'll hear alternative therapists say, well, scientists have got no idea about this particular therapy because they haven't bothered testing it. That's rarely the case. So it was good to see so much research had been conducted. In some cases, more research needs to be conducted. In others, I kind of feel we've hit the end of the road.
Sure.
Something like homeopathy, for me, I just think after 200 years, after 200 clinical trials, there's no convincing evidence. How much more is going to be required, because I can't see the situation changing. So I would see that I prefer money going towards things like massage therapy or yoga, or maybe the Alexander technique, which have begun to show some interesting positive signs in treating particular conditions. So I was surprised perhaps by the amount of research.
Do you think those sort of complementary and alternative medicines that have been shown to show a small but significant effect should be embraced a bit more by the NHS, or how do you think public spending should be associated?
If something's been shown to work and it's safe, then we should seriously consider using more of it. And you have this idea of integrated medicine, of some of these ideas moving into the mainstream, and I think that's great. It's one of the things that Edzard again often gets painted as being a villain, as this guy who hates alternative
But that's very strange as well, because he started out as a homeopath, didn't he?
Well, when he graduated from medical school in Germany, he worked, I think, at the Munich Hospital of Homeopathy and learned homeopathy there and practiced it. In fact, his parents had given him homeopathy, and herbal remedies are much bigger in Germany than they are here in Britain. So he was very sympathetic, and then he moved out of being a doctor, a medic, into medical research, and that's when he learned about how you test things, mainstream and alternative, and now he's moved back to alternative, but from a testing point of view rather than from a practicing point of view. So he's very open-minded. I think he's very reasonable. He's very academic, and he's often painted as being a villain of alternative medicine. But I think he often, you'll find many articles from him endorsing particular remedies, or saying to mainstream doctors, look, you need to know about alternative medicine because your patients will ask you questions about it, and you need to know about particular alternative therapies because there's actually some evidence that they work.
Yeah. Well, anyway, I think that's enough. Thank you very much for coming along.
My pleasure.
I hope you've enjoyed it.
Yeah, no, I mean, it's great. I mean, I talked to Skeptics in the pub in London. I'm going to be going to Oxford soon. So it's great to see these things flourishing and growing, and seeing people coming together, partly to listen, partly to question, and partly to debate. It's been a very, very enjoyable evening.
Good. Excellent. And I hope you come back again.
Thank you. Will do.
Thanks. Good.